Okay. So I know a bunch of you are going to be jumping on right in the beginning here. So I cannot see the chat screen of my PowerPoint. So if you have any questions as we're going, feel free to type them in. And then at the end, if we've got some time, I'll answer some questions. So sometimes I'll answer a question before we're done. Other times, I may not answered it. So I'll answer it at that time. So again, thank you all for joining me. We people from all over the United States. We got a couple people tuning in from Singapore and the UK. So special shout out to you all, because I know you're in Singapore, you're 13, I believe you're 13 hours ahead of us. So it is bright and early in Singapore. We have a patient there, so I know that it's definitely early, and those in the UK also welcome. We do have a bit of my office said there's a lot of correctors on the call tonight, which is great. So I'm special welcome to you, my fellow colleagues. So hopefully tonight will be helpful for you. We're going to go over craniosacral therapy. For those of you that are parents and or also doctors, this is the way. I don't go into this detail when I talk to patients about it. So I love that I'm going to have this webinar tonight and also have it available in the future, because it's very helpful to explain what we do in practice and how it actually helps, because people often describe craniosacral therapy as a massage. It can look that way, but it is very, very, very far from massage in general. It's not even in the same ballpark. So, but you can find massage therapists that are trained in craniosacral therapy sometimes, although not a common thing to find. So we're going to talk specifically about craniosacral and its role in development and healing. I actually did speak at an autism conference back in 2011. For the of you that have children with autism, I was at Autism One, which is Jenny McCarthy's deal. And it was great because when craniosacral, I think, got a little more press and a little more popular, as we say. So I actually spoke about it at that conference, and so I've added some things to that, but still, again, all really applicable. So I'm Dr. Amber Brooks, and I'm actually in Dallas, Texas. That's where I live and where I work, of course. My practice is whole child wellness, and here in my office, I only see children. My focus and my specialty and my gift is really working with those children with early developmental issues and really focusing on early intervention. This is I use a tremendous amount in my practice. I find it to be a little bit secret weapon. Behavioral issues and things are my focus. So my integrative approach, I do chiropractic, of course, I do, and craniosacral therapy, I would define as a technique, although it's not one that we learn in school. I did learn that with my specialty in pediatrics, although I know there are, I do teach it. My specific school did not. So I also focus on nutrition development and underlying causes of symptoms. So most parents come to me because they don't know what's going on with their child, or they're given a bowl and they don't know what to do with it. So I'm about to really dig and find the functional reason for why something's going on and work with a family to help maximize health and wellness. I am board certified in pediatrics as a chiropractor. I've been doing craniosacral. I've been a chiropractor. I've actually been doing craniosacral for about 9 years. And my approach, again, is functional and integrative. I'm also a nurse, which, so that's kind of where I take my traditional training and then my alternative training in chiropractic and nutrition and work together. So I often am working with the pediatricians, developmental pediatricians, GI docs and things, to help a child the best way that I can. I also authored a book, 15 Things Your Doctor Doesn't Know About Your Child. And for me, it really started out as for my parents, because the parents have so many questions and there's so little time when you're in our offices to really tell you everything that we want to tell you. So I thought, well, shoot, I'm just going to sit down and write everything. But it's right under 200 pages. And I started infancy through food, early signs of delays, different therapy options, food allergies, how to introduce first foods, all those little things that parents need to know. So it's been a tremendous benefit for me in my practice, because it's a way all of my new patients get a copy. And it's just some way that we can help you get help for your child without having to pay to talk about it. Other docs on the line, you can actually use this in your practice. It comes from a holistic or alternative, obviously, frame of mind, which may be good for you in your practice as well. So again, I give it to my new patients and them chapters, although many of them read the whole thing. And it gives them a very good understanding of what functional medicine is, what we're doing, why diet is important, what's important. So, you may want to check it out. I also have a called Healthy Kids Nutrients, which you can check out at healthykidsnutrients.com. My practice website, if you want to find information, I have a ton of research on our website page. So for you docs that need maybe some leverage or some things to show some of your parents, and of course, parents, if you want to find out more, you want to learn more, and you want to see the research behind the things that we in our practice, or maybe you're looking for a practitioner that does the same, you can find that there. And of course, my consulting website. Social media, we're on Facebook at Whole Child Wellness. That might be how you found out about tonight. It's where I post a lot of information. You can also follow us on Twitter. And then I do YouTube videos once a week. I put them, and they're very short. They're 5 minutes, usually 5 to 7 minutes. Last week, it was a bit longer. It was about 9 minutes because I went through Friday what you look for in a supplement. How do you, what are the things that you need to look for? How do you know if it's a good supplement? And then, of course, I went through my top 4 supplements that I love and why. So you can check those out. I find those to be very helpful for parents. So you docs on the phone, you may want to just keep in the loop what videos I'm posting or what I have, and you can actually put them into your newsletter and things. So hopefully it helps you educate your parents as well. The disclaimer, I'm not giving any medical advice on tonight's webinar. So that's so that you have an understanding. You need to see your doctor for any medical treatment. This is also my intellectual property. So nobody has permission to reproduce it. So let's talk about craniosacral therapy. Hopefully most of you are getting on the line. Before we get off, I'm actually going to have you download a couple of the slides on here that I think are the most useful, as well as information. So I'll have that available at the end here. Craniosacral therapy was developed by Dr. John Upger. He was a DO. He actually just passed away a few years ago. And he started doing craniosacral in the 70s. And it was actually used to evaluate and enhance functioning. And what's weird is he actually started in a lot of the quote unquote mental facilities, because these were people that had dropped off their loved ones, or they were put into a home, a long-term care situation because their parents or family members couldn't take care of them. And so these people had no hope of getting better other than the medications being used. So he actually went in and treated these patients and kind of used it as a model, if you will. So some of the first patients that were given craniosacral therapy by him were children with autism. So I always found that very fascinating. The craniosacral system is made up of 3 things: the cranial bones, the cerebrospinal fluid, and the membrane. So those are the things that I would be working on with a patient that was being treated craniosacral. I'm going to say CST for short for the rest, because that's a pretty long word. So the CST system, its basic premise is it bounces the nervous system. So I always say, in chiropractic, we do chiropractic adjustments to a child's spine to realign that are misaligned, right? That's a bone thing. I always say that craniosacral is the complement to that, because it takes care of the soft tissue that a chiropractic adjustment can miss, especially with infants. So the autonomic nervous system is made up of your sympathetic, which is your fight or flight, and your parasympathetic, which is your rest and digest. So the 2 systems have to be balanced for the body to work really well. So these are common signs of symptoms of autonomic nervous system dysfunction. Everything from feeding issues, which we'll talk about tonight, nausea, vomiting, et cetera, et cetera. So obviously children aren't coming in with some of these, but obviously this isn't a therapy just for children. I do take adult patients every now and again, because it is very difficult to find a craniosacral therapist. And of course I have parents coming in from all over the place. If they're willing to make the drive, I'm always willing to accommodate. So it's one of those things. Sometimes it's just not easy to find someone who does it. And it's, I always say, sorry, I'm losing a bobby pin. I always say that not everybody has the gift of being able to do craniosacral. And I think chiropractors on the phone, you definitely understand what I'm saying here, because this is definitely art, not a science. You can teach someone what you're supposed to do, but don't necessarily feel the restriction and feel the restriction release. So you can kind of quote mess somebody up if you don't do it properly. So that's why I always am very, I would say, like an overprotective mom with the kids that do live a distance. When I'm trying to find somebody to take care of them, I'm very particular about that. And you need to make sure, if you aren't sure about who you're going to or not sure about who to see, you need to just ask questions. I always say parents need to ask questions of any provider that they're going to go see, right? How many children do you see, et cetera, et cetera. So we know what kind of training they have. We talk a lot in craniosacral about the rhythm, and I want to explain what that is. Cerebral spinal fluid, which is CSF, is produced within the brain itself, and it's reabsorbed once it gets to a certain pressure. And the picture that I have on this slide is actually of the brain, kind of, if you cut the head in half, right and left side, and then you open it up, that's kind of what we're looking at here. So the CSF is where those arrows are. That light blue stuff is cerebral spinal fluid. And the brain contracts at a normal rate. And so why the cranial bones come into play here is because we are putting our hands, I'm putting my hands on a child's head. I mean, the bones, I always say, is kind of like they're kind of like the handlebars. They're what I'm working with. But they have to pump, they have to move ever so slightly so that they can pump and contract to move the cerebral spinal fluid. So in that fluid making that motion, just like blood running through your heart makes your heart beat, this creates what's called the craniosacral rhythm. So when I'm on a child's head, I can feel the rhythm through the cranial bones. If the cranial bones are restricted, that's what causes you to lose that rhythm, right? Where cerebral spinal fluid can't move through correctly and gives you symptoms. Some of the symptoms we'll go over, and we've already touched on. Easy things to fix with craniosacral things are feeding issues with infants, ear infections, chronic sinus issues, things like that, or headaches are very common things that people seek out CST for. So when I'm working on a kiddo, this rhythm is actually what I'm detecting, and it helps me determine how restricted the cranial bones are, because if those bones are restricted, I'm going to get less of a rhythm in the cerebral spinal fluid because there's restrictions there, right? So that rhythm is actually just the CSF itself. So that's what, when people talk about this is what I'm feeling, what they're actually feeling is that CSF rhythm, which is really, I always say as a practitioner, it feels like tug of war. You know, like something's, I'm wanting to feel it and it's kind of tugging in one way when I want it to go another. And as a patient, when I'm having it done, I feel like water is moving on my brain. Like I can feel it kind of moving over me. So it's really quite interesting to experience it, and both as a practitioner and a patient. So I would encourage you to do that. Even if you're a parent and you want to experience it, if your practitioner will, it's always a really cool thing to get to experience, because children have described it so funny. There's so many ways. This is typically performed by a person trained in the technique. And what does that mean? This can be any licensed professional. So you can have a chiropractor, you can have a massage therapist, you can have an occupational therapist. I think there are some lactation consultants that do it. I think it just depends on what your scope of practice can be. So it's definitely something that a broad range of practitioners can be trained in. It's just not something that a broad range of people are good at doing, because it takes a lot of practice and a lot of time to become really good at it, just like anything else, right? This is actually me working on infant. So for parents, I like to always show them how gentle it is. And you can see him kind of giggling and laughing. And this was a long, long time ago, actually. I think this was probably 8 or 9 years ago, maybe 8 years ago. Very, very long time ago. Anyway, but CST is a really gentle hands-on technique. As you can see, I have my hands on his head and I'm using the very, very tiniest of weight. They say the weight of a nickel, that's the way to determine it, but that is how light of a touch you're using. So your practitioner would place their hands on the cranial bones and monitor the rhythm that we were just talking about. And those locations go all over the head. I usually start in the pelvis and I work my way up to the head. And then, like I said, I always kind of I always kind of feel like it's a tug of war. So the way I explain it to parents is when I'm working through the bones should move ever so slightly to pump that cerebrospinal fluid that we just talked about, right? So when they're not moving in the way that I want them to, that means they're restricted. And that's actually what I'm working on. I'm not pushing, I'm not pulling, I'm not forcing. The babies and children should never be in pain. They should never cry. Those are not normal things. I've had parents come in and say, well, their head was bright red. There was finger marks all over their head. They screamed the whole time, but I thought that they just had to put up with it. And those are all very abnormal things. So sometimes practitioners, when they're first learning, they press too hard or they put too much pressure on. And really, this is a technique. The lighter you are, the more that you feel. So that's why you really shouldn't see any of that happening with your child. You shouldn't see crying. You shouldn't see screaming. There are kids that can be a bit uncomfortable during certain parts of craniosacral. And I think the distraction is the key. I have a mobile in my office that I actually drop down from my ceiling for babies to watch. Also nursing during this, sucking on a pacifier can all be very helpful because it can help regulate the rhythm that they're feeling. And sometimes I would describe it as pressure. So when they have restrictions, it can feel like a pressure headache, like a sinus pressure headache. For those of you that have had sinus pressure headaches, it really can be uncomfortable. So that's why this can help with things like reflux and colic, because these are the things that cause those things that can help. So when you have these things worked on, it can be really amazing. The treatment is really aimed at working on the membranes. Although we're feeling the bones are, like I said, the handles, right? What I'm really trying to get at is that tissue, that membrane tissue, to help improve the flow and exchange of fluids, those fluids being the cerebral spinal fluid. So this is not about realigning cranial bones. That's not what we're doing here. We're not doing osteopathic manipulation. So those kiddos that come in with flat spots or torticollis is when the neck is turned one way or tilted one way and they can't really move it. That's torticollis, which when they're like that, they end up getting flat spots on their head, right? Which is called plagiocephaly. So when they get those flat spots, sometimes the doctor will recommend that a child get put in a helmet. And this can fix those flat spots because this is also going to fix, in many cases, the torticollis. So if you fix the torticollis and the baby can move their head freely, then it will fix the flat spots. It just takes a little bit of time. So in a lot of cases, you actually don't need to use a helmet. But I will tell you, no baby has a brick-shaped head. So a lot of times they're just doing helmets to make the head look pretty, when it actually, what it does is 23 hours a day, it actually puts pressure on the skull, and it actually does decrease and mess with cerebral spinal fluid moving in and out the way that it should. So it's definitely something you always want to make sure that you go, for me, that you're going to alleviate any reason why you would possibly have an issue, or could fix something before you ever go the route of a helmet. So if I have parents that are saying, well, we're thinking about getting a helmet, I always say, let's give this a shot first. Infant and development. So I kind of want to take you. The baby I'm working on this picture was 6 weeks premature. You can see how tiny he is. I mean, I have pretty big hands for a lady, I'll tell you, but look how tiny he is. He doesn't even fit into his clothes. He's just drowning in them. So this is Cannon, and he was a preemie. Mom brought him to me. He was probably right out of the hospital as soon as she could get him to me. Birth process can be a big reason why restrictions exist. That picture of the skull, these are the fontanelles. So that's also called, what weak soft spots, right? So you can see these bones aren't touching yet. So this is why they're so easy to work on in this stage of life, because these things aren't actually touching the way that they do as they grow older. So there is so much that can be done in infancy. And I would always tell a parent, get help as soon as you can. The longer you wait, the more time it's going to take to fix the problem. It's never really too late. But if your baby has reflux, this is something that can be alleviated in probably 3 weeks, versus keeping them on a medication for 6 months to 12 months. Also can keep them from having scopes and being anesthetized and all those fun things. So like I said, those large spaces are called fontanelles, and they allow space for growth. If you have restrictions in these cranial bones from the birthing process, it will stop growth in certain parts of the brain. So there are correlations to development there. So when these are not corrected, lots of things can happen. You can have chronic ear infections. You can have chronic sinus infections. I have kids that have, quote, they've always been congested their whole life. Well, that's usually just a cranial restriction. And then you have it being more serious. Kids with speech delays, kids with problems with writing, listening, comprehension, hearing. Those are all fair game here. So how would you know as a parent that your child is suffering? How do I know I have to call someone? How do I know I have to get help? Right? These are the most common signs and symptoms in infants. I want to talk about that first because parents often ignore a lot of the signs and symptoms because the pediatricians will tell you everything is fine. These are some things that you really need to get kind of, get an assessment for. Feeding problems are a big one. Latching issues, what I call a lazy feeder. So they'll feed for a little while and then they'll just stop, or they'll fall asleep, or they'll start screaming. And that is pain, guys. All that is pain. If their latch is bad, there's bones in the roof of your mouth that can be stuck that you can easily get rid of and have them latching and sucking better. Also, those kids will also have really sensitive gag reflexes. So the reflux actually might be their suck swallow reflex isn't working well. So they're not able to take in the amount of milk being given, whether that's breastfed or bottle fed. And so they'll choke and spit up, and we call that reflux, but it's really not reflux. Abdominal bloating, constipation or diarrhea, darker light intolerance, troubles with sleep, reflux. Tugging their legs up is a big one. These are the kids that are always kind of in a ball. They're never floppy and relaxed like they should be. They'll also fist their hands and pull them in. Parents might have trouble dressing them. So if you're trying to dress the baby or change their diaper or put a shirt on and you just can't get their arms to come out, it's because that is a pain behavior. So it's really something you want to be watching for. Of course, decreased range of motion. They'll turn to the right, or they won't turn to the left, or they'll breastfeed on the right, but they have a really hard time doing it on the left. So we want to make sure that they're breastfeeding equally and on both sides for the same amount of time, because that's an indication that they're uncomfortable. And then, of course, colic. Colic isn't real. Colic is just discomfort, and discomfort is usually caused by this. Here are the cranial bones. So not all of them that we work with in craniosacral, but this was the best photo I could find for you. All of these bones, your practitioner is going to go through and feel to see how they're moving, and typically get them moving rather quickly. So the kids, all you'll need to bring to an appointment is like something to distract them. Their favorite book. I have parents that let them watch certain videos on their iPad only when they're in my office, so they know that when they're here for that 30 minutes that we're working on them, they get to watch their favorite movie or their favorite show. So it works really, really well. Distraction is the key. This isn't painful, but getting a kid to sit still for 30 minutes is very, very difficult. And often parents will say, I don't know how you get them to sit still for 30 minutes. And the truth is they like it. They know I'm helping. They know it's working. They know they feel better. And I have most of my kids in my practice are nonverbal. So we have to still, no matter what age they are, you have to distract them from 0 up. Just have to find something for them to do because they get bored. So these are the cranial bones that they will go through. And what you'll want to know, hopefully they're taking good notes, what bones are stuck, and they can teach you about how they grade their restrictions. That's very subjective to each practitioner, but I'll always tell the parents, this is how I grade a restriction so that they know from treatment to treatment, are we getting better and are we not? And typically my kids start to improve in their restrictions being lessened after about 2 to 3 weeks. So that's what I can expect. Here's the CSF again. I wanted to give you the purpose of it. This is a bigger picture of what I already showed you, but it's really important because it delivers nutrients, oxygen, hormones, neurotransmitters, and it transports waste and toxins away. So this is super important. If it's not functioning right, as many things as we do to kids, I mean, they can walk outside and they're exposed to toxins, but that's on top of the bad eating, the medications, the vaccinations, all the other stuff that they're getting. We need to make sure that they're getting enough nutrients spread throughout their body. So this is really, really important. I always tell a parent, it doesn't hurt to get craniosacral therapy. It never hurts unless you're going to someone who doesn't, obviously doesn't know what they're doing. But in a perfect world, that's not an issue, right? So they should only benefit from craniosacral therapy. So when I talk about the rhythm, I talk about tissue. What tissue am I talking about? Remember, we talked about cranial bones, membranes, and cerebral spinal fluid. So I showed you the bones. I showed you the CSF. Now I'm going to talk about the membranes. There's 3 layers of membranes that surround your brain. The main tissue that's involved here is your dura mater, also known as the tough mother. It's the outermost layer of the membrane, and it surrounds the brain and spinal cord like a wetsuit. So you can see this picture on the top. This is actually the tissue in gray. And then the falx cerebri and the tentorium cerebelli are also tissues. And you can see that the falx cerebri actually divides the right and left sides of the brain. So kids, when they crawl, is when their brains start talking. Right and left sides start talking to one another. If you have restrictions on one side or the other, the brain can't actually coordinate that thought. So there have been kids in my practice that had speech delays, dysgraphia, trouble with dyslexia, that got better with craniosacral because the left and the right brains are now talking to one another. Even coordination, motor coordination, things like that kids struggle with, this can help with as well. So the purpose, obviously, of this membrane is to protect the brain and the spinal cord. It's also used as an electrochemical conduction system. So all the nerves come out of our spine. So we always teach parents that it's really important to get chiropractic adjustments because the nerves come out of your spinal column, right? And those nerves innervate everything in your body. Well, this is also true for craniosacral therapy. These membranes, everything has to puncture through these membranes to function well. So if you have a restriction, I always describe it as the membranes are like wrinkled sheets on your bed when you get up in the morning. So my job is to go in there and steam iron all the wrinkles out so the nerves can puncture through perfectly nice tissue and go and innervate the places at 100% the way that they should. So again, this is always just a wonderful therapy to do with chiropractic with it. Okay. Okay, so Jenna, are you seeing the slide change now? I'm confused. There is a little pause between me and you guys when I do it. Is everyone seeing me go through the slides? I'm concerned now. So I'm already on slide 14. So as far as restrictions go, okay, good. Yeah, Jenna, it is a little bit delayed. As far as restrictions, contractures in the membrane, like we just talked about, create restrictions. That can be cranial bones. That can be cranial bones and anatomical connections between the bones and the tissues. So again, I've already said this, but we use cranial bones as handles. And I always say, what's it feel to a child? The restrictions feel like, I think they feel like pressure, like a headache. I also feel like it's like I'm lighter, like I'm physically lighter when I have it done. It can help with anxiety with children. It can help with sensory processing issues. It helps their body just relieve the things that they don't know how to relieve or cannot relieve on their own. So it's really fantastic. And kids can feel all kinds of ways. But I always describe it as pressure. But if a kid's always had it, they really can't explain to you what it feels like. So parents often ask me, well, how do you get these restrictions in the first place? Are they just, as every kid, just born with them? Not necessarily, although I probably make a really good argument after over 8 years of practice that every kid has them, because I have yet to work on a kid who doesn't. It's just a matter of how bad are the restrictions. So as far as how do you get restrictions, these are the most common ways that I can describe to parents when they need to either, if their kid was vacuum extracted, forceps delivered, or cesarean section, a twin birth, a difficult labor, or a breech baby. Those are all no-brainers to go get care. All no-brainers. The earlier, the better. Obviously, the earlier you get it, the less of less the symptoms you'll see. Most of your babies will become symptomatic to the point where where you as the mom are going, okay, something's not right here, between 4 and 6 weeks. And that's partially because, remember the bones that I showed you that have those fontanelles and that space to grow? They go through huge growth spurts around this time. And those restrictions actually get tighter. So the colic, the reflux will often start between 4 and 6 weeks. And I've seen that pretty standard over the years that I've been doing it. And that's just based on all of my experience. But that's what I'll tell you. It'll almost be, and if it's immediate, if the baby's immediately having reflux and colic, that probably means that they had a pretty bad birth trauma. So you need to get them in immediately. Surgery is another reason, stress on the nervous system, and that can be a lot of things. That can be food, that can be chemicals, that can be chronic illness. Childhood falls, pretty common, right? Between gymnastics and soccer, football, trampoline, especially my boys that are rough and tumble, falling out of a tree, even falls you don't think about, oh, well, they landed on carpet. Well, kids are like bouncy balls, I will agree. But if a kid's had some falls or they're athletes, it's always a great idea to get them checked out. Self-injurious behavior. So these are kiddos that are banging their head, biting themselves, scratching themselves, which I know to some of you may be like, oh, kids do that. Oh yeah, kids do that. A lot of the kids that come into my practice do that. So if they're headbangers, you need to, there's a reason why they're headbanging above and beyond this, but this will help clear out some of their discomfort and pain while you do further testing or refer them out for functional medicine testing. Trauma, of course, birth or otherwise, that includes motor vehicle accidents. Infections and illness are also a common one. So if you've got a kiddo getting illnesses, sinus infections, you have chronic ear infections, you've taken them in for, you've had tubes, all that fun stuff, that is just a dead giveaway that you need to get some of these restrictions released so that they're not chronically sick. I can't tell you how many kids I've helped that were chronically sick or chronically had sinusitis or ear infections. It is really just limitless in what it can do for those things, because it really works through and drains the lymphatic system the same way an adjustment does, just again, from another perspective. So what do we see in the kids that you bring in? Parents are telling me about poor sleep, processing problems, delayed milestones, aggression, attention difficulty, possible issues with neurotransmitters like I'm not sure how their serotonin is, or I have kids that are on serotonin medications like SSRIs or other psychotropic drugs. That's a giveaway that we might be able to help there. Detoxification issues, kids with inflammation, which you often don't know unless you've done testing, or sometimes parents, you guys will come in with testing, so I know what's happening. Speech delays. I've helped a ton of kids with speech delays using craniosacral. Birth trauma, we talked about sensory processing. This is actually something that I just happened to realize in practice. Never did someone tell me this. Like they talk about it now, that's because it's kind of after the fact. But kiddos with sensory processing issues are going to be either your sensory seeking or sensory avoiding. Those could be your kid might be licking things, stemming on things, wanting to jump, wanting to run in circles, wanting to spin, biting their clothing, licking things, just doing things kind of out of the ordinary, don't want to be hugged or want to be hugged a lot, hate haircuts, hate having their hair washed, hate having it brushed, won't do their teeth. All of these things that should be just very normal parts of your nightly routine of bathing are a complete nightmare. Those are great candidates for craniosacral. Trouble concentrating and hyperactivity. It is immensely wonderful at helping with behavior, because remember what it does is it takes that fight or flight and it brings it down. It calms the system down. So I always tell parents jokingly, the side effects of craniosacral are increased appetite and better sleep, because most of them leave here tired and hungry, which is great, right? I wanted to go through craniosacral in its relation to autism for those parents on the phone that have children on the spectrum. According to the autism spectrum disorders are related in part to a loss of flexibility and inflammation of the membranes. I can tell you inflammation is rampant in children with autism, and that's because the majority of my practice are children on the spectrum and have been for as long as I've been in practice. So this is something I find to be so helpful for children that have autism, and any parent that has a child with autism need to get this care. There needs to be no question. What we know. So we know that with autism, we have increased levels of pro-inflammatory cytokines. We've got inflammation changes in the cerebral spinal fluid per Johns Hopkins, which did a study on kids with autism. We know that there's restrictive forces on the brain tissue, and that strain that we've talked about, or those restrictions that we've talked about, can help the brain in development. So the reason, it's not like craniosacral therapy is going to make a kid who wasn't talking before talk. It's that if my speech centers in the brain are restricted by these restrictions and the cranial bones on top of those speech centers aren't moving correctly, it can help free up the transmissions to work better. So I always describe it as congestion on a freeway. You know, if you're dead stopped in traffic and you're not going anywhere, I need traffic moving at 60 miles an hour with no interruptions. That's what craniosacral does for children in general, not just those with autism. It opens up those pathways so that they can function the best that they can. Behavioral challenges are a big one. It's like when your baby comes home from the hospital. It's either crying or it's happy, right? And we don't know why it's crying. Is it hungry? Is it dirty? Is it sleepy? Whatever. There's very few things that an infant needs, right? But as they get older, their behavior gets different. Their behaviors might be banging their head. They might be stemming and flapping. They might be aggression. It might be attention deficit. It may be not being able to follow directions or impulsivity. So these restrictions may look like colic or ear infections at 6 months and might look like sensory issues or trouble with focus at 6. And they can oftentimes be related to these restrictions. So I always say, if you even think that this could be something that could help your child, you need to get care. Areas of the brain. So we talked a little bit about that tonight. This is the color, the nice pretty one that's heavily marked up there. This is how your brain is broken down to what its functions are. So like I said, every kid that's nonverbal isn't going to get craniosacral and start speaking. That's not what I'm saying. What I was just saying is those parts of the brain that have restrictions are also being restricted on the craniosacral front. So why not alleviate that so it's one less thing the body has to deal with to be able to have proper function? So I always show my parents this and how interesting it is, because sometimes craniosacral has done things when I've worked on kids I never imagined it would do. So I always say the sky's the limit with improvement on this, because it's not until I start working that I really notice how bad a kid is messed up. And it's just they love it. First of all, they love to come in. They love to have the therapy done. It feels so good and they feel so great. It's just one of those things. It's kind of a no-brainer for parents to do. It doesn't do any harm like a lot of the things that you could potentially be doing. And then the other picture is just some other, the lobes of the brain that will, like the temporal lobe will correspond to the temporal bone, occipital bone, same thing, parietal, same thing. So this kind of breaks down the different parts of the bone. So hopefully this is a really good representation of where restrictions can be, which is anywhere, and how they may affect behavior, brain, and of course, development, right? Development's a big one. Is development impaired? So like I said, development can be impaired in the portion of the brain that has restrictions. It's happened way too many times for me not to believe that statement. Is it ever too late to get craniosacral? Absolutely not. I think my oldest craniosacral patient right now is his second year in college. So it's never too late. Those restrictions will always come up. They'll always be. So you can always go and have things done. Even as an adult, I can go in and have a treatment done any day of the week and have issues to find. However, those issues haven't caused me some of the pain, discomfort, and symptoms that you're experiencing with your child. So here are the benefits, and a slide of this after this, because it's important for you to share with your spouse or family members that are helping you take care of your child. So as far as behavior goes, it's been shown to help with calming and being more relaxed by decreasing that structural strain and putting them into that parasympathetic that we talked about. And when these things are balanced in the tissue, then your brain can move that cerebrospinal fluid around and flush toxins out, which is really desperately needed for any and all of us, let alone children. So obviously it's going to increase those neural pathways, right? Because that tissue is not wrinkled. So all of the nerves that puncture through there are going to puncture through there with no traffic, able to get to exactly where they need to get. And then craniosacral by nature helps the immune system as its natural healing mechanism because it helps flush out toxins and helps open up all lymphatics. So it's fantastic for that. And of course, normalizing the nervous system, which is how we started this talk this evening. Indications for craniosacral. So these are the things as a parent, if you have struggled with or are currently struggling with any of these, you need to get some help. You're going to get a copy of this slide as well, just so you can kind of look it over with more time. A lot of these I've gone through already tonight just in talking with you. So, you know, the most common ones for the babies we went through, but the other, I'd say most of my kids in the practice are probably between 3 and 6. That's when most parents start to see delays and need help. And again, that's my specialty. So that's where I'm getting them. If they're having stress behaviors, self-injurious behaviors, we talked about, poor sleepers are a big one. Maybe your kid had a previous helmet. That's a big one too. Bedwetting issues, constipation, big one. Attention and hyperactivity are also big ones. So just know that this may not answer, this is not necessarily going to be the end all be all, right, for a kid with ADD. But in my practice, because I'm doing a functional approach, I'm using chiropractic, craniosacral therapy, and I'm doing nutrition and diet stuff. So a lot of times between those things, you're really kind of nailing it in and getting to everything that you need to get to. So hopefully, you know, you can get help. You may not be able to find one practitioner to do all of this, but you certainly can find a few of them, right? I wrote a lot of stories, I would say, or I tied in a lot of examples, patients in the book. So you can get a lot of information about craniosacral in the book because I talk about it constantly in the book. Different case scenarios of patients that came in. You can get that on our website. For those docs on the phone, we actually offer a discount when you buy them in bulk, so you can sell them to your patients. Or again, just use them and give them away as part of your education. You can also get it on Kindle, iBooks, Amazon, Barnes & Noble. And then, of course, Healthy Kids Nutrients, really excited about the new line. You can check it out there. And we do offer free shipping over orders of $150. For you, doc, may want to carry any of this in your practice, you can contact me and we have pricing available for you as well. Next courses. So please share this information with your friends and family if you have found these things helpful for you. The next one is Wednesday, May 13th. It's going to be, I've been doing these in the evening for parents because I know a lot of you work. And for my docs, I actually do them in the middle of the day because it's a little bit easier for us to schedule it in our day because we go home and have a lot of other things we have to do. So the next one for parents, the next free webinar is Wednesday, May 13th. And this is going to be talking about behavior changes from the inside out. So from the inside of our body, how they're affecting us and what they look like and present on the outside, and strategies for ways to improve that. Clinicians, these are clinician only, not available to parents. The next one I have for docs and clinicians is Tuesday, May 19th at noon, Central Standard Time. And we're actually going over how to do a pediatric evaluation. So those are $25 and you can sign up on our website. So please find us there and sign up for those if you're interested. I haven't made my June ones yet. So I'm still thinking about what I want to do. So this is how you stay in touch with me. So you can do that. Again, we kind of went through this in the beginning. So what I'm going to do is I'm actually going to try to upload my little handout that I have for you all. So let me ask, do any of you guys have any questions about what I've over tonight specifically? I'm going to give you a second to put anything down that you want.